Today I'm going to be talking about gingivitis and periodontitis. Periodontitis and especially gingivitis are oral diseases which affect much of the population today. The destructive disease periodontitis always begins with the less severe gingivitis. Gingivitis is detected through redness, bleeding and swelling of the gums, which can cause pockets to form around the teeth. You can see here that the gums are inflamed and red, as well as bleeding around the teeth. The severity of gingivitis and periodontitis can be determined by gently inserting a periodontal probe into an area of the gum called the sulcus and measuring its depth. Here you can see this instrument here, which is called a periodontal probe, inserted into the area of the gum called the sulcus. Gingivitis does not necessarily lead to periodontitis, and it can be reversed with proper treatment and maintenance of oral hygiene. The signs of periodontitis are destruction of the gum and bone tissue, recession, pain, and ulceration. In this picture, we can see severe recession, and in this picture, we can see a radiograph where the alveolar bone has been destroyed by the disease. As we can see, when we compare gingivitis to periodontitis, you can see that the destructive symptoms are much worse than gingivitis. That's why gingivitis must be treated and prevented from progressing. However, progression of periodontitis can be stopped and can be partially healed through proper treatment, but it can never be completely reversed. The cause of gingivitis is mainly due to toxins produced by the bacteria in the plaque biofilm, which inflame the oral tissues when the body tries to fight the bacteria. In this picture, we can see that the bacteria are releasing toxins and other sorts of chemicals which inflame the tissue around the tooth as well as the alveolar bone. Everyone will get gingivitis when plaque is not removed after a few weeks. If the plaque is still left to accumulate, the oral tissues will become more inflamed and gingivitis will get worse. Here is a diagram or illustration of the reddening of the gums here when plaque is present here, which are agitating the gums. Unlike gingivitis, not everyone with gingivitis will progress to periodontitis, as this also depends on other factors such as heredity and smoking, which influences the way your body reacts in response to the bacteria in the plaque. So what is plaque biofilm? The plaque biofilm is a mass of bacteria which grows on oral surfaces. It has often been described as having a furry or rough texture that can only be felt on the tooth surface. It forms by bacteria initially sticking to a protein film called a pellicle, and then they grow in number and develop a protective coating which is resistant to antibiotics and antimicrobials. They then mature, increasing in the number of harmful bacteria and decreasing in the number of good bacteria, and spreading to other areas in the mouth. We can see in this diagram here that the bacteria initially adhere to the protein pellicle, then they increase in number or proliferate, then they form the protective coating and mature, where they have a primitive circulatory system. They then are sent to other areas in the mouth and the cycle starts again. Certain factors may influence the amount of plaque present. For example, habits like not brushing your teeth or flossing increases the levels of plaque present. Social factors may also influence your plaque levels. For example, upbringing and culture may have placed less emphasis on oral hygiene. Plaque retention is also increased when calculus or overhanging restorations is present, which makes it easier for the plaque to stick onto the surface of the tooth. As you can see here, these restorations here is an ideal surface for plaque to adhere to, and it's very difficult to remove this plaque when brushing or flossing your teeth because you can't reach into this area. This is why